Hi, good afternoon. My name is Meagan Gray. I'm a transplant hepatologist at the University of Alabama at Birmingham. And today we're going to spend a few minutes talking about non-alcoholic fatty liver disease, or NAFLD. So NAFLD is quickly becoming one of the most common liver diseases, not only in the United States, but also globally. It's estimated to affect about 30 million people in the United States. And when we look at our Mid-South region, it's estimated to affect over 8.9 million patients. Patients who are at risk to develop NAFLD are those who are overweight, who have diabetes, high blood pressure, high cholesterol, and all the features of the metabolic syndrome. So within NAFLD, there's actually a couple of different categories. So some patients with NAFLD will just develop what we call simple steatosis. So they'll have more than 5% fat in their liver, which is considered abnormal, but this fat isn't causing any inflammation or damage, and these patients are very low likelihood to move forward and develop advanced liver disease. However, there's another population within the category of NAFLD that we call NASH, and this is non-alcoholic steatohepatitis. And this population of patients not only has more than 5% fat in their liver, but they also have a lot of inflammation and damage happening from that fat. And these are the patients who are at risk to develop scarring and cirrhosis and potentially even liver cancer and potentially even need liver transplant. So it's this population of patients with NASH that we really want to target for interventions because they're at the highest risk of developing complications related to their liver. So when we talk about staging liver disease, we want to see how much scarring or damage in the liver has already happened. And so we can grade that on a scale from 0 to 4. So 0 is when you have a normal healthy liver without any problems at all, and then 4 is cirrhosis, where the whole entire liver has been replaced and damaged with scar tissue. So when we catch patients with non-alcoholic fatty liver disease in the early stages, the disease can be completely reversible. And so things that we know that can help reverse the disease are weight loss and also very good control of other metabolic comorbidities like the diabetes and blood pressure and cholesterol. In patients who are able to lose 10% of their body weight and maintain that weight loss, they can reverse all of the fat out of their liver, and they may also be able to reverse some of the scarring and damage. The things that we focus on when we're talking to patients about diet interventions specifically are reducing refined carbohydrates in the diet and reducing saturated fat. So refined carbohydrates in the diet include things like white rice, white bread, candies, cookies, any sugary beverages. All of those things are processed and turned into fat in the liver. And then the other big culprit is what we consider saturated fat. And this is the fat that comes from your fatty or animal products. So things like sausage, bacon, red meat, pork, eggs, cheese, butter, or full-fat dairy. All of these things are very high in saturated fat, and these also directly turn into fat in the liver. So the diet that we typically recommend is what's considered a Mediterranean type diet. This diet is full of fruits and vegetables, whole grains, beans, nuts, lean meats like chicken and fish, and then low-fat dairy products. And this type of diet also includes unsaturated fats, which are fats that come from plants, and these fats are very healthy, help reduce inflammation, and can also help reduce fat in the liver. And these are things like olive oil, nuts, and avocados. So that's our lesson on NAFLD today, and please let us know if there's anything else you would like to know.